I had a new patient who came to see me yesterday, and he said to me, do you do implant bridges or do you do single implants? What he meant was that he's got 3 teeth missing. And he was wondering whether it's best to have an implant, an individual implant supporting each missing tooth, or whether we can use 2 implants to support a 3-unit bridge, essentially replacing 3 teeth but supported by 2 implants. There is no definite answer to that. The answer is it depends on what's best for you. So things we look for are, do you grind your teeth at night? If you do grind your teeth at night, then we might consider putting an extra implant for that extra support. However, if that's not a factor, it is going to be more cost effective for you and probably easier to have 2 implants supporting 3 teeth. But also in the aesthetic zone, we generally don't put 2 implants next to each other. So if you have 3 teeth missing, it's almost a rule of thumb that we don't put 2 implants next to each other, that you will end up with a bridge rather than individual implants. A bridge is a little bit more involved to maintain because you have to get floss under it rather than be able to floss it like your natural teeth. But it is just a slightly modified technique. It's not all that difficult. So I guess it really depends on your situation. I can't stress enough, there is no single answer to every situation.